Since the birth of the Tavistock Clinic a century ago, a number of institutions have been part of the wider Tavistock family. These have included the Tavistock Institute of Human Relations, the Tavistock Institute of Medical Psychology, the Tavistock Career and Education Consultation Service, and Tavistock Relationships. At the time of the 50th anniversary of the Tavistock, the eminent psychiatrist Henry Dix wrote of its corporate identity, within which separate constituent organisations are not only preserved, but positively valued. One of these siblings, Tavistock Relationships, was originally formed as a family discussion bureau in 1948. Tavistock Relationships has specialised in developing the psychoanalytic understanding of the couple relationship. So it's somehow fitting that it began its life as the metaphorical child of a couple, Enid and Michael Barlint, both of whom understood the difficulty of couple relationships, both having entered their second marriage. Tavistock Relationships has, since its inception, been a sister organisation to the Tavistock Clinic. The two have shared a history of personal and professional links and a common approach of rigorous grounding in clinical work as a basis for research, training, and the application of analytic thinking to a wide range of human difficulties. Each has shared a mission to reach people and touch areas of human experience that have not before had the benefit of analytic understanding. With its focus on developmental challenges and possibilities throughout the lifespan, this distinctive Tavistock approach has always been at the core of the work of Tavistock Relationships. The organisation went from strength to strength. In addition to providing a clinical service, it began developing professional training, a research arm, and a series of publications. Since these early days, Tavistock Relationships has produced more than 700 publications, which have influenced globally the development of couple and family mental health practices. And in 1968, the Family Discussion Bureau changed its name to the Institute of Marital Studies to reflect its status as a practice-informed training and research body. During the 1960s, training activities increased further, and the IMS located itself in the same premises as the Tavistock Clinic in Belsize Lane. Intern fellowships were created for experienced practitioners working in other agencies, with extramural training provided for organisations such as the Probation Service and the National Marriage Guidance Council, now Relate. Throughout its history, clinical services have remained at the heart of Tavistock Relationships' work and have informed the founding and development of its groundbreaking and wide-ranging programmes. The volume of clinical work undertaken has grown considerably, and today the organisation delivers more than 20,000 psychotherapy sessions per year. It also offers psychoanalytic, psychodynamic and psychosexual professional clinical qualification trainings at postgraduate level, as well as certificate level and foundation courses, and a CPD programme addressing current issues in the field. The significant rise of the organisation's international influence has been reflected over the years in its trainings, lectures and joint working around the globe in Australia, China, the US and Europe. Its popular summer schools attract a diverse blend of international clinicians. In 2018, Tavistock Relationships held its 70th anniversary conference. At the event, it launched both a book celebrating the range of its innovative work and Mary Morgan's landmark text on the theory and technique of couple psychoanalysis. Although the balance of clinical work, research and training has varied at different times in the history of Tavistock Relationships, they have remained inextricably linked throughout. This blend of key elements is what Henry Dix called the internal matrix of the total Tavistock organisation. It is this which most clearly identifies Tavistock Relationships as part of the Tavistock family, maintaining this distinctive blend of practice, training, research and innovation from its inception and through the generations. It is this which will no doubt provide the creative platform and cohesive approach needed to ensure success in the organisation's future endeavours.